One update that's at 4 p.m. And this is going to be probably a little bit longer of a one today. We're going to hear from a number of other people as well. For those that are watching, normally I have Dr. Stack and Eric Freelander standing behind me. They are here today. We are just trying to practice social distancing better and better each day. So what we will see is when folks step up to talk, I'm going to step to the side at least 6 feet because we want to try to model the type of behavior that people should be using. Let me start by saying, Kentucky, we will get through this. It's going to be a major disruption that we face. Our lives are going to change and change a lot over the next couple months. And the steps that we have taken are significant, and we're going to have to take more as we move forward. But we are doing this to protect our people, and we will get through this. We talked yesterday and the day before now about Team Kentucky. We are all in this on one team. It is us versus the coronavirus. And so we need you to do your part and to be a good teammate each and every day. That means following the guidance that's out there and making sure that you not only protect yourself from the coronavirus, but that you also make sure that you are practicing the type of social distancing where you would not be spreading it either. One other thing I want to mention in being a good teammate, and that is making sure that you share. We have seen some runs on different items in the stores today. I was made aware of a young mother who couldn't find formula for her child. You don't need 8 months of baby formula, and if you have it, and you got it because you were scared, I want you to share it. We have got to look out for each other during these times, and if we let fear drive us and drive our decisions, that's going to harm more people than this coronavirus ever will. So I'm asking everybody out there, let's be the best version of ourselves during this, and that's going to require a lot. It's going to take a lot of courage on all of our parts, but I tell you, if we are good neighbors to each other, we will all get through this. All right, our update today is as of the tests that we have received now, I believe that we have 16 positive cases total in Kentucky. There is only a little bit uncertainty in whether one of those is a repeat of another, but we believe we have 16 positive cases. I'm going to go through them from the first one we received to the last one we received. The first was in Harrison County, a 27-year-old female. She's now out of the hospital and out of the woods, and we love hearing and seeing that completely through this coronavirus, and what an example for all of us. Second, 40-year-old male in Fayette County. The third, a 69-year-old male in Jefferson County. The fourth, a 67-year-old female in Harrison County. The fifth, a 68-year-old male in Harrison County. The sixth, a 46-year-old male in Fayette County. The next, a 54-year-old female in Harrison County. The next, a 60-year-old male in Harrison County. The next, a 51-year-old male in Harrison County. The next, a 31-year-old female in Fayette County. Then we had one from Jefferson that we are still awaiting the confirmation in our lab for, and I don't have the demographics on that. If there is a repeat in this, this is the one. The next is a 66-year-old male in Bourbon County. We have not previously been able to identify that one. That was the one that yesterday we had confusion over. They are being treated in the hospital. The next is a 68-year-old female from Jefferson County. The next one is an 80-year-old female from Jefferson County. Then we have a 53-year-old male from Nelson County. Also, I think some connection with Meade County there. So the way we're referring to it is Nelson/Meade. And the last is a 56-year-old male from Montgomery County. So those are the 16 positives that we believe we have, giving us a little bit of room in case there is one repeat there. Again, they're coming in now from 3 labs, and so the timing can change, and also how long it takes to turn around those tests can change depending on the lab. We have 31 more tests that I'll get the results on tonight from our state lab. I want to go over the steps that we have taken thus far and some new steps that we're going to announce tonight. Then we're going to hear from our folks that are here with us from Bourbon County. We have their Judge Executive, Michael Williams, their State Representative Cook, and Andrea Brown from the Bourbon County Health Department, just talking about what they're doing. Again, we are all on one team, and we are working day to day with our local health departments and officials. After that, we're going to hear from Jody Prather from Baptist Health, all our hospital systems stepping up and being a part of this team. And then at the very end today, we're going to hear from Dr. Alan Brenzel on some of the self-care and mental health that we need to be thinking about, especially with all of the closures. So, steps we have taken to date. I declared a state of emergency to give us the tools we need and the dollars that we need to address this coronavirus. We activated our Emergency Management Operations Center and the State Health Operations Center. We announced Kentucky's COVID-19 hotline, which is 1-800-722-5725, 1-800-722-5725. We are now getting about 2,000 calls a day, and I have to ask that for Kentuckians, those are calls for people who are concerned or have concerns about the coronavirus and their own condition. We've gotten a couple calls from reporters to that hotline. Please do not call that hotline with questions for that purpose. That is for our citizens who are fall into a couple of categories. We launched the website, which is The Definitive Source. James, if you'll put that up, kycovid19.ky.gov, kycovid19.ky.gov. This is the definitive source. We're pushing everybody to this one source. If you want to know something from state government, from our guidance, this is where to look. On here, we also have, if you'll put up the infographic, when to seek care. One of the biggest concerns that we have and that we have to avoid is overwhelming our healthcare system. We have to make sure that we have enough capacity in that system to treat those who are truly sick and the most sick. So what we need from each and every Kentuckian is to make sure you follow some of these advice. So if you are nervous, but otherwise not sick, you are well, but nervous, call the hotline. Do not go to a healthcare facility. If, on the other hand, you are sick but otherwise wouldn't have sought care, think allergies, think cough or cold, I know you're nervous because the coronavirus is out there. Again, call the hotline. Don't overwhelm our healthcare facilities. But if you are truly sick and would have sought care and or you are injured and need care, make sure you do go to those healthcare facilities. Just like not making runs on essential items, we got to be a good neighbor in how we use our healthcare facilities. We in the state have to prepare for the real possibility of the significant number of cases we expect to see moving forward, and making sure that we are ready to handle those cases. That takes all of us working together as Team Kentucky. I issued an executive order to prohibit price gouging. If you believe you see price gouging, call the hotline, 888-432-9257. We're asking businesses to implement paid sick leave or other policies, make sure there's not any incentive for people to come back to work sick. We have done so in state government. We published the CDC guidelines. The main importance there is they talk about the most vulnerable to the coronavirus, individuals over 60 and those with heart, lung or kidney disease. Think about diabetics, those that are suffering from COPD, lung cancer. We got to make sure that we do everything we can to protect those populations. We're now asking everybody, don't fly. Whatever you do, don't get on a cruise ship. We're recommending social distancing now for everybody. And I know it seems like a big step. It's being 6 feet away from others. But let me tell you, stand 6 feet away from the person that you are with right now. You can have a good conversation. You can convey emotion. You can have that human interaction that you want and that you need, but we need you to do it. It's critically important in addressing this and protecting the most vulnerable. We're also asking you to engage in the best hygiene you ever had in your life. Even if you engage in really good hygiene, engage in better hygiene. Wash your hands with soap and water. Make sure you clean your home or places of work multiple times a day. If you can't find the commercial cleaners, use a 1-100 bleach solution. And if you can't find hand sanitizer, remember soap and water works better. Just wash your hands for over 20 seconds. Issued an executive order and worked with our state Medicaid to waive copays, deductibles, and other fees and costs related with this testing. And I'm going to ensure through either the emergency, through the state of emergency or others, that those that are uninsured can also get a test at no cost. We're going to make that happen. We're working with all 120 county judges. We had one of our first calls with their emergency management network. This is going to be more and more important as we go forward. You're going to see county judges declaring states of emergency themselves. It's something that we're asking them to do because we may need to take certain steps, one of which I'll announce at the end, which is about what happens when someone who's tested positive refuses to self-isolate or stay in isolation in a hospital. We are recommending no visitors to our long care facilities and nursing homes except in end-of-life situations. And we're asking our senior centers to close. And that is a difficulty on a lot of our seniors. We want to work with everyone to make sure we can get meals delivered, and we'll make sure that we can provide the type of funding or shift the funding needed to take those in-person meals to people's homes. We asked our schools to shut down for at least 2 weeks, and all of them have, and I'm very grateful. The steps that we take work when more and more folks agree to it. It is a big step. I know it's going to be a huge disruption to people's lives. I tell you, it's absolutely necessary, and by everybody agreeing, it's going to be that much more effective. We closed our state prisons to visitors. We have advised all community gatherings to be canceled or postponed. Please don't think that if you just have a smaller number or spread out, that it means you can't spread the coronavirus. You absolutely can. Can you put up the graph, the line graph? It is incredibly important as a people that we limit our contacts. This is a graph we've been showing that comes out of Seattle. The blue is business as usual, and the number of cases that are expected. This isn't Kentucky centric, but that are expected or have been seen. Our healthcare system would have a hard time with that type of a spike that we see there. What we have to do as Kentuckians is to limit our contacts, to reduce them, to make sure that we are one of the other colored lines. We would really like to be the red line because that is the safest line for our people. And that is what, if you're holding a community gathering, if you're going ahead and doing it, what you're doing is creating a lot of contacts that would otherwise be reduced. And we just need everybody to be a leader out there. And I know it's tough, and I know it may disrupt the finances of a group, but this is us, Team Kentucky, versus the coronavirus. And I understand all of this. After all of this, there are going to be some groups or industries that have been slowed, some that have been shocked, and some that have to be rebuilt. but that's where we are, and we can be committed to doing it. We suspended all out-of-state travel for state employees. We're recommending that businesses do the same. We are encouraging businesses to allow people to work from home as much as possible. Where it's not possible, spread out, practice good hygiene. We recommended the temporary closure of senior centers. We announced that effective immediately, Kentucky Employers Mutual Insurance will provide wage replacement benefits for first responders and medical personnel who have been quarantined for the coronavirus as a result of their work. Folks, the front line in this battle against the coronavirus are our healthcare workers. They are brave. They are amazing. They're showing up every day knowing that they could be exposed to this. We got to be there for them, and we ought to appreciate them for their work. We announced as part of being more virtual that boards and commissions in the state are going to cancel in-person meetings and do as much as possible by video teleconference technology. They will provide a live stream so that the public can follow what's being done. We followed the emergency declaration from the Federal Motor Carrier Safety Administration, which is providing regulatory relief for commercial drivers who are providing direct assistance to this battle against the coronavirus. The USDA has approved our waiver to be able to serve meals to students during non-traditional instruction. That's a very good outcome. I know our schools are working really hard, that our recommendation was that they cease in-classroom activity, and that's just a way of trying to say any way they can continue to keep the children engaged. We want them to have the flexibility and absolutely the flexibility for the basic human services that are provided to kids. And then we issued guidance to our own state to allow telecommuting where possible. We even have a goal of reducing our in-person state employees by at least 50%. You're going to see us continue to look at any emergency regulation or other step we can take to where people who right now have to come and see someone in state government to get something done, to be able to do that virtually, over the phone, or online. We're going to work every single day on it. An update on the passengers on the Grand Princess. 14 of them are at one Air Force base, I believe 2 are at another. We hope to get the 14 home tomorrow. These are our people, and they have been through a lot. And I know we can take care of them. They deserve to be at home, and we want to get them there. Since we learned that there were going to be additional difficulties yesterday, when we thought things were on track, I've made personal phone calls. Our Commissioner of Public Health has. All day long, Latasha Buckner, my Chief of Staff, has been. We hope that we have 14 of the 16 home tomorrow, and we are working on the other 2 that are at a separate base. To those watching, we care about you, and we know you've been through a lot. I promise I'm doing everything I can, and I really hope that you will see some Kentuckians smiling face tomorrow there to pick you up. New actions that we are taking today, and these are some substantial actions. We are going to get through this, and that's what we need to always remember, and we need to stay calm, but you're going to see escalating steps as we go. We are asking all of our Kentucky hospitals to cease elective procedures by close of business on Wednesday. We're going to work with them. We're going to rely a lot on their judgment for what is elective and what is not. The fact is we need all the capacity that we can to deal with the cases that we believe that we are going to see. We're going to work with them to give the flexibility to repurpose a lot of their staff, and if we see the escalation of cases, which we've always talked about, we expect to see, we want to make sure that we have the resources to help every single one of those people. There's some misinformation out there, and it came from one of my agencies. That was my Office of Early Childhood. It was a communication that didn't come through our office, and I want to make sure I address it before it creates any additional confusion. It's going to be another tough step, but we're asking the child care centers in Kentucky to create plans for closure that they could enact within 72 hours if we deem it necessary. I know a lot of people are watching this and wondering how they would deal with that, how they would manage the child care. If it wasn't absolutely necessary, or we didn't think that it would become or could become necessary, we wouldn't ask for these plans. We hope this gives people some lead time. We just have to do what it takes to lessen the spread of this coronavirus. And I don't want to be the governor that waits 2 weeks too late to take some of those steps. Last, I want to say that we have had the first instance of an individual who has refused to self-isolate, and we have taken the steps to force a isolation that will be in their home. This is a Nelson County resident that has tested positive, left against medical advice, refused to self-quarantine. We have worked with the county judges and others. It's a step I hope that I never had to take, but we can't allow one person who we know has this virus to refuse to protect their neighbors. So please, out there again, if you get this, for 80% of people, you're going to be just fine. You're going to be just fine. But what you can do is harm so many other people. So be a good neighbor. Do the right thing. That's all we're asking of people. And finally, with various privacy laws, I can't say a whole lot about this, and I can't identify the case, but we have one individual that is tested positive that's in pretty bad shape. There are a number of different factors that have led to this condition, but we are thinking and praying for that individual, and there is even an expectation that individual might not make it. We'll provide an update tomorrow on that condition, but again, there are multiple factors that have led to that condition, and if we have the worst outcome, there will be multiple factors that will have led to that. With that, I'm going to introduce, I got to go all the way back in my notes. I'm going to first introduce Bourbon County Judge Executive Michael Williams. One of the new cases is in Bourbon County. We appreciate the leadership from all of our county judges. This is one team. Judge?
Thank you, Governor. We all wish we were here under different circumstances today. Folks in Bourbon County woke this morning to the news that we had dreaded, we had anticipated, and assumed might happen at any time, that someone, one of our friends and neighbors, a family member for many, had been diagnosed with coronavirus, COVID-19. That was not the news we wanted, but it's here. We will deal with that and encourage everyone in Bourbon County certainly to continue to follow the calm and steady and spectacular leadership of the governor as he guides us through this crisis. As the governor said earlier, there is a light at the end of the tunnel. While we may not see it yet, we're all looking for that light, and we will make that, we will achieve that together. We are committed in Bourbon County to cooperate with the governor's administration and certainly federal officials to do all that we can to protect our citizens. Encourage everyone to follow the simple rules of hygiene, to be protective of those who are from the models or the most at risk for being made ill or even worse from the virus. And we know that, again, that folks, whether you're an elected official or just a community leader in Bourbon County, are going to follow those rules and do everything that we can. And we appreciate, again, so much the governor giving us an opportunity to recognize that we've reached that milestone, although it's an unwanted milestone in Bourbon County. We're there, and we're determined to partner with the state to continue to protect the citizens of Bourbon County as well as our neighbors. Had the good fortune to talk with Judge Alex Barnett this morning, our neighbors in Harrison County, and he shared the good news, as the governor mentioned earlier, about the individual that had been diagnosed in Harrison County had been released from the hospital. So we know those good things are going to start happening, and we look forward to more good news like that. Thank you very much, Governor.
Thank you, Judge. Next up is Andrea Brown from the Bourbon County Health Department. Our health department employees are absolute rock stars. I mean, they have answered the call. They are so prepared. Folks, we are lucky, and they are in each and every one of our communities. I wish it didn't take this for us to appreciate them the way that we should. Andrea.
Thank you, Governor. I just wanted to reiterate everything that the governor has said and what Dr. Stack has said previously and what Judge has just mentioned. The health department, the local health department in Bourbon County is working very, very hard to slow this disease. We've been working very hard, even before it got to Kentucky, pushing out those messages about the prevention measures that we have all been reiterating over and over and over again. We are working very closely with our community partners. We are working very closely with the state government, with the Department of Public Health, and with the governor's office, and we are here to really work with our community to stop the spread of this disease. We have taken some significant measures, like the governor has already said, with closing the schools. We are postponing and canceling large public events, and we are working with all of our partners to really enforce this at the local level, to really put in perspective of really doing those prevention measures that we've all been pushing. Washing your hands often, more often than you normally do. Stay home when you're sick. Contact your provider by phone first before going in to the medical facility. They can really guide you through this process, and covering your cough, and just really following these guidelines, as it is so important to listen to this, especially for our most vulnerable population of 60 and older and those with chronic conditions. We are really trying to slow this spread as best we can, but we need everybody out there to follow these procedures and these strategies. So please, to our community in Bourbon County and everyone else across the state, utilize that hotline that the governor has given us for questions, and please go to that website, the Kentucky COVID-19.ky.gov, because that really truly is the best information that is out there, and it's consistent, and it's updated regularly, and we are trying to push this unified message so everyone gets the important facts all together at the same time. So again, we're working in Bourbon County very hard. My team is there right now, working all hours of the day and night until we can get this under control. And I'll turn it back over to you, Governor. Thank you.
We also have Representative Cook. You want to say a couple words? Come on up.
Thank you very much, and I'd just like to start off by thanking you, Governor, for the response. It's very needed at this time, and appreciate everything that's going on. United we stand, and I just want to let everyone out there know that we need to work together, and that we'll get through this. And Judge and Andrea, everybody out there, listen to our healthcare professionals, work together, and take care of each other. Thank you.
Thank you. All right, next up, and I know we've got a lot of people today, but there's a whole lot of people that are helping us on this, and we want to recognize those folks, because we've got to have our hospitals step up and provide the type of care that people need at the time when they need it the most. So we have Jody Prather here from Baptist. Jody. Dr. Jody Prather here from Baptist.
Well, thank you, Governor, and I'll be brief. I'm here. I'm the Chief Strategy Officer for the Baptist Healthcare System across the state, with our 8 facilities in Kentucky and 1 in Indiana. But I'm here primarily as a family physician from the state of Kentucky, who has spent my professional career trying to take care of folks. And what we're here to say is we have been working very hard, and we're glad to say, in lockstep partnership with the Commonwealth and with our other agencies and all our communities, to prepare for this. We've been preparing for this. We continue to prepare. We want to reassure each other, reassure the state and all of you all that as much as possible, we are literally meeting daily, hourly, with all our clinical leaders across the state, with all our community leaders, with all our agency leaders, to try to make sure that we are prepared in all of our communities to deliver the type of care that our folks need, that our patients require. This is quickly changing. I was talking to Dr. Stack this morning. That's the kind of relationship we have between us and the state. And this is ever evolving, but I want you all to know that we're working hard with the state to make sure that we're changing with this and that we're ready to respond. We've had positive tests in the Baptist system now. We're preparing for the eventuality that we may have positive tests in every one of our hospitals. And I want to reassure everyone that we are ready to take care of those folks. We're prepared. We're trying to avoid and encourage our communities to do the appropriate things from a prevention standpoint that the governor has outlined so effectively, that Dr. Stack has outlined so effectively. But we want you all to know that in our 350 plus outlying facilities and our 9 hospitals, that we are as prepared as we can be for what this disease is bringing to us, and we'll continue to work with the state. And we just like to applaud the administration, applaud the governor for what they're doing, and continue to do, and we'll continue to be a partner in this every step of the way. So thank you.
All right, and next is Dr. Alan Brunzel. We didn't know we'd have as long of a program when we first asked him, but now that we have asked people to reduce contacts, and that's something about our daily lives. It's a big part of our emotional health. We want to make sure that everybody is taking care of themselves during this. And since there's going to be a prolonged period of lessened contacts as we move forward, I asked Dr. Brunzel to come and talk a little bit about things that you can do for your mental health, how to take care of yourself. And folks, take this part seriously. We are a resilient people, but we want to come out of this in a healthy place. We want to come out of this better and ready to do so much that we haven't been able to do, and however long it takes us to get through this. And I want each and every one of you all out there to come through this with your family in a good place. So here's Dr. Brunzel.
Thank you, Governor. It's my pleasure to be part of the governor's team and be part of the response to this crisis. And as he mentioned, I'm Alan Brunzel. I serve as the medical director for the State Department of Behavioral Health. I'm also an associate professor of psychiatry and pediatrics at the University of Kentucky. And I do want to address very briefly some of the psychological aspects of this situation. And I will tell you that the most difficult thing about this situation is uncertainty. And uncertainty leads to anxiety. And so managing uncertainty is difficult but that's why these press conferences are so very important. And I can assure you the information that we have, that we are able to share, we are sharing as soon as possible and in a fashion that you can rely on that information. Because in a situation of uncertainty, what happens is anxiety. And anxiety is a good thing, and anxiety can be helpful. Anxiety causes us to stand up and pay attention and do things. And so having this anxiety will cause us to be compliant with the recommendations made by Dr. Stack, our public health care officials. And so anxiety in and of itself is not a bad thing. What we do is have to be careful not to be overwhelmed by our anxiety. So I have some specific recommendations for folks. Number one, stay informed, but use reliable sources. Use sources that you can count on, like our website, the CDC website. And I'm asking you not to expose yourself to too much information. Too much information leads to confusion, which will increase your anxiety. And I'm asking you that you don't need to update yourself every minute of every day. Please take a break from social media, take a break from searching for information, and try to live your lives. It is, as I said, important to stay up to date, and we will keep you up to date. Preserve your routines to the degree possible. We understand your routines are disrupted. There are many things about your day that you can continue to do in a routine fashion that will help soothe your anxiety as well as that of your family and children. For us, even these press conferences are becoming routine that is helping us manage our anxiety, and we appreciate the media helping us get information out for folks to stay informed. Take care of your own health, because this situation of reducing your risk involves staying as healthy as possible. So if you have a condition, please take care of yourself. Be compliant with treatment recommendations. We don't need you accessing our healthcare systems unnecessarily. So please be compliant. Make sure you have your prescriptions available. Attend your therapies that are continuing, and take care of yourself. The other recommendations are good diet. One people may laugh at in this room is sleep. We do recommend that you get sleep, that you eat a healthy diet, and also exercise. I think the governor has recommended outdoor activities are ideal, and spring is here, and so we do encourage people to get out and about when weather permits. And continue to find ways to relieve your stress, whether that is doing something you enjoy. Don't suspend all of those activities. They may be challenging, and everyone obviously manages stress and anxiety in different ways. But find the ways that you can still find enjoyable activities and relax. And the other thing is this paradox between social distancing and social connectedness. I think the governor alluded to it. We're not asking people to be isolated. We're asking them to distance themselves. So we need to look for opportunities to connect with others, whether it be virtually, through technology, through just appropriate distances. Because being together is really important for us to decrease our anxiety. And so if these strategies don't work and you're overwhelmed by your anxiety, please get help. We have resources. There are behavioral health professionals across the state. I have many colleagues. Our community mental health centers stand ready to help and assist, and they're available in all of our communities. And so please get help if needed. And then very briefly, I just want to address the issue of children. Those of you who have children or are caring for children know this can be specifically stressful for children. Number one is take care of yourself. Children look to us for guidance. They're going to mirror our reactions and our level of anxiety. So please take care of yourselves first so that you can provide an open, calm, and reassuring environment for your children. And children react differently by age. Obviously, a 2-year-old is very different than a 16-year-old. But the key is an environment in which they would feel comfortable asking questions, that you would take the time to answer their questions in an honest, straightforward way, adjusted, obviously, for their developmental age. That's what will reassure them. Be sure to tell them the things you're doing to keep them safe. Model for them the things that they need to do to keep themselves safe, because the children will want to contribute to helping solve this crisis. So hand washing for children is very important as well. Hygiene for children. We need to be modeling that and then helping our children implement those policies as well. Other things apply in terms of providing routines for children, even more important for children to continue to have as many of the routines you can maintain as we make adjustments. Limiting your media contact for children can be even very, very important. We're not sure what they hear, what they see, whether they can analyze that information often. They may be hearing about Italy that doesn't apply to us, and they may assume that's happening here. So if they are exposed, ask them what they're hearing, ask them what kinds of conclusions they might have drawn. That's that opportunity for open dialogue that you can provide to them. Yeah, we don't suggest that you mislead them or lie to them, because later on, as things change, they want to be able to trust the information you provide. So providing quality information to them is important. Now, some children won't want to talk about it, and there's no reason to force children to talk about that. Some will prefer to play basketball, be outdoors, and let you as the adults handle this, and that's okay as well. If they are separated from their peers, and friends, and other folks in their social supports, provide them opportunities to interact electronically and digitally. We are concerned if there are children who've had other losses in their life or who have maybe behavioral health conditions, maybe more susceptible to being overwhelmed by their anxiety. They're going to need more of your time and attention. You're going to need to spend more time with them. And some of them may need to seek professional assistance as well. If you see severe behavioral changes, clinginess, maybe trouble sleeping, need for a lot of reassurance, repeated questions, those are all normal responses. But if you see a lot of behavioral changes that concern you, seek some advice and counseling from a mental health professionals. I think at that, I'll conclude. We are going to put some resources available on the site that will help parents talk to their kids, give you some additional suggestions. I just want everyone to be assured that our team is working to make sure that behavioral health services remain viable and available. We're looking for what kind of creative flexibility we can provide to our providers so that they can use telephonic connections with folks. And we'll be doing that as quickly as allowed, and we're pushing the limit to the wall to make sure that the behavioral health services remain available.
Thank you. All right. With that, we'll move into what will be about 15 minutes of questions. If we have 15 minutes worth of questions, they don't have to be 15 minutes worth. We have been asked by people that are watching for me to repeat the question. So if I don't like your question, I'm going to change it and answer it differently. I'll go back and forth with some that have been sent in, and some that of you that are here today. Though Morgan, you're here, and we've got one. We did give you clarification on the Grand Princess. All right, who's next? Yes.
Can you elaborate on how the Nelson County resident was forced into isolation?
So there is the authority, if a county judge has declared a state of emergency under our state of emergency, to invoke a statute that can force a self-isolation or quarantine. It is something that we don't want to have to use, but this is a state of emergency through the state, and we've got to make sure that people who have tested positive, that we know could be spreading the virus, and who simply refuse to do the right thing, do the right thing.
Well, how's this being enforced? Does he have an ankle bracelet, or is there a deputy outside?
There is a member of law enforcement that will be outside the home. Again, we don't have the resources, or we shouldn't have to use the resources statewide on this type of thing. When I was talking about yesterday, Rudy Gobert from the Utah Jazz, and he said he's willing to be an example, so we're making him one, of being a bad teammate. He touched all the reporters. Here's the video. Their thing, don't be Rudy Gobert. Don't be the bad teammate in Kentucky. And if you've tested positive for this virus, make sure you're doing what you need to do. Don't require us to use resources. By the way, you all can't see this, but the Commissioner of Public Health just gasped watching this video. All right.
Is the person in Nelson County, so they're currently isolated at home?
The question is the person in Nelson County currently isolated at home? I believe so. That has been in process. We've been working on that this afternoon.
What's the Meade County connection? Why are you saying Nelson and Meade on that person?
That's what my notes say. I'll have to get you additional clarification on that. Again, we're moving pretty fast.
Governor, can you tell me which county the person that's in bad shape is?
The question is, can I tell the person that's in bad shape that we're praying for what county they're in? I can't identify that at this time. We believe under privacy laws, and with what the situation that's there right now, I want to give that family a little respect.
Have you been able to find anything more since President Trump's press conference yesterday on how this aid will benefit Kentucky's efforts?
So we're working through that. The state of of health emergency, I believe that the president signed, is going to help. We got to work through all the different ways. I know it provides for certain flexibility. We're working through whether we have to also request that flexibility under Medicaid. Certain flexibility for facilities to use different parts of the facility to address the coronavirus. So we know it's going to be helpful. We're just working through the exact ways. I'd also like to see the bill the House passed to come through as well. There would be substantial funding, substantial assistance in that. At a time when it's all hands on deck, I'd ask the federal government to do everything you can because we are certainly doing it here on the state level.
You ran through a list of all the current 16 cases. Could you
just clarify which of those are new, versus yesterday, and just the totals?
The Montgomery County case, I don't believe was included in yesterday's. The Nelson/Meade County case was not included in yesterday's. One of the Jefferson, we did not know whether it was a repeat or not. And then the one that we had some confusion about where it came from was in Bourbon County.
And the one in Jefferson, you still don't know if one of the 4 in Jefferson
It is because we have not received. It was done at an outside lab, and we have not received it yet. We can't match it up to verify it.
And any ideas with those, how many are hospitalized, how many people are hospitalized?
Well, that's starting to change because people are getting out of the hospital, which is great. And we haven't. What we do is we track when it initially happens. Where folks are. For instance, on my notes, I still have that very first patient as being in the hospital, and she is out, and she is fully better. I know that Norton Brownsboro was able to discharge individuals as well. It looks generally like it's been about half and half thus far, and that's perfectly okay for those that are at home. And are staying in good shape. That's a comfortable place they can be as long as we've got the right monitoring and the right type of self-isolation.
How old is the person who's in bad shape?
Again, we can't provide additional information on that at this time. We will
Not even an age
provide an
range?
update tomorrow. I think if we provided the age range, people could know who that individual is at what may be the last moments of their life.
Was this someone that had the aggravating circumstances that you've spoken of?
We believe that there are multiple circumstances that are contributing to the condition, but they have tested positive for the coronavirus. I'd hoped that we wouldn't have anybody in this type of condition throughout it. This is why we're working so hard to try to limit the number of people here. Finding out about this one has been tough, and we hope that there can be a recovery, but we're very concerned with their status.
You said at the get-go that our lives are going to change and change a lot over the next couple of months. I think a lot of people really are asking themselves, how long is this going to go on? And that's the closest I think you've come to suggesting how it might go on.
The question is, how long do we think this would go on? Because I said next couple of months. The answer is we don't know. We do believe that there will be a duration, that we will get to the other side of this. We're pretty certain of that. It's just the exact amount of time. We don't know. The more we cut the more steps we take, the more that we are able to cut down on the contacts. If you'd bring up that slide again, James, our hope is then the less disrupted our lives will be. Now, school is going to be out, or we're ceasing in-person classes for at least the next 2 weeks. There may well need to be an extension after that. We want to give us some time in those 2 weeks to see where this is going. Our hope is that we'll get data back at some point showing that this is working. But what we got to make sure in the short term we're doing is not having the big spike. And that's where everybody is a part of this team. You follow the guidance. We all do what we're supposed to do, and we can hopefully manage this in a way that protects the most number of people.
So just a clarification.
Okay, they've clarified it's only Nelson, not Meade.
Governor, to clarify, so we have 16 positive cases now, and there's one that may be a duplicate?
Right. So while I believe there's 16, and we want to make sure that we're not holding any number back, it is possible that number is 15. And we have 31 more tests tonight, and we expect more positives. That's not based on any of those particular cases themselves. It's just that we expect to see more positives as we go. Let me read a question or two, and then we'll get back. What are we doing to track the clinical status of patients whose tests are denied by the state? I may need Dr. Stack for that one.
Thank you, Governor. So as we move on for the testing, we're going to rely on the commercial industry to provide this. And so I thank you for the opportunity to comment on this, Governor, because we really are working with the hospitals and the other clinics and other settings in the commercial labs to get those individuals who need testing to go that way. That's the healthcare delivery system, and we rely on that. So the discussion about what our lab is doing or not becomes much less relevant as we go forward. Our lab now, as we go forward, will be in a support role to make sure that we validate that outside labs are producing accurate results, and that we selectively screen those people who are of unique public health importance that the lab needs to know. But the delivery system will rapidly take over the function of testing, just like it does for every other condition we have. I want to also just make the comment that as we recommend these significant changes to our lives, these are things that are being done around the country. And so I'm in regular communication with my fellow state health officials in other states. Dr. Amy Acton is just to the north of us in Ohio, and we're in regular communication. And Ohio is doing things very much like we are doing. These are substantial, but we believe they're absolutely necessary, and we believe that here Team Kentucky is going to rise to the challenge, and I thank you all for your help with that.
Great.
Doctor, you might be the best one to answer this question.
Let me just add on, and then we'll bring him back up. We still want to reach the day where everyone who wants to get tested can get tested. We want to get there. Every time we get an estimate from the federal government on that, it's different, but we want to get to that point. Until we are at that point, we have to use our resources the very best that we can. It's one of the reasons we ask people to call the hotline if you wouldn't have otherwise sought care. We will work to get to that. Now, you're starting to see some things around the country where there are different capabilities or where there's been a different level of the coronavirus. You're starting to see in some places drive-through testing. That's not possible right now in Kentucky. We look forward to when it is. I can guarantee you when we have that capabilities, we will be pushing the widespread testing that will make everybody feel better. But until then, let's remember, let's be a good neighbor. Let's understand there are a lot of people out there that need help, and let's make sure those that need help the most get help.
Regarding the hotline, there was a report in the New York Times this morning that said some calls to the hotline have been answered with a busy signal and then with a recording. Is there a problem with staffing the hotline or access to it?
So our understanding is that we are now receiving 2,000 calls plus a day on the hotline. It does typically start with a recording. We've intended to play it at one of these. You have to press a specific button, which if you listen to the recording gets you there. That's because we had to take the poison control hotline and convert it to this. It is staffed through Norton, one of our community partners, and they are hiring more people every day. We anticipate that will continue because a lot of calls to the hotline are a good thing. I don't want to tell people not to call unless you're a reporter asking a question and then send it a different way. But anybody out there who's calling the hotline because otherwise they would go to a doctor's office, that is a good thing.
Would you mind going over just to make sure, we want to make sure we're right about this, the 16 cases, how many in each county? Because we had heard there might be 7 in Harrison, et cetera, so we just want to get...
All right, I'm going to do my best counting.
Thank you.
We have 1, 2, 3, 4, 5, 6 in Harrison. We have 1, 2, 3 in Fayette, and I'm not sure we've confirmed each one of those is a Fayette resident. We have 1 in Bourbon, 1 in Nelson, 1 in Montgomery. The rest are in Jefferson, and so that would leave 1, 2, 3, 4 in Jefferson, and we haven't confirmed that each one of those is a resident.
The Nelson County one is a resident of Nelson.
Yes.
Okay.
These folks on the Grand Princess, what exactly is the state doing to facilitate their return?
We're sending the National Guard to go get them.
How many does it take to do that?
Oh, it's we're sending both transportation and a healthcare team down. I don't have the exact number, but we want to get them home.
Is that with cooperation from the CDC to make it happen?
It's with cooperation from HHS is who we're working on with it. I did have to ask, and I asked very strongly, but they said yes. I think they're trying to do the right thing, but these people have been through a lot.
What was the hitch?
dealing with the federal government, probably. The question was, what is the hitch? And I gave it an answer that's joking, and I hope everybody can understand the levity. It's just different healthcare professionals, different portions of government approaching things differently. These are folks that are going to have to self-isolate still when they get home, but it's time that they got home. These are our people. And as governor, these are my people. And I want to get them back to Kentucky. Tom.
One of the things that you talk about is go out and do things, but avoid big crowds. What about going to restaurants?
So if you can do takeout, we believe that you should. And you know what? Order takeout. Brittany and I are going to order takeout tonight. We want to support that restaurant industry. And where I live right now, we got pretty good food. I'm still going to order takeout to support a local restaurant here. I know restaurants are going to make some changes. They ought to make some pretty significant changes on density and the rest. But local businesses that are around you that are going to be impacted by this, if you can help them in ways, spend some money, help do different orders. I know they're going to try to adapt. And everything we can do to help everybody get through this is being a good neighbor. Got another question, if I can read it. What are you all doing about DCBS, home visits, family visitations, social worker visits during this? We are suspending home visits except in an immediate risk or high risk only circumstances. It's a step that we have to take. We are going to do our very best to make sure that we are there when those kids need us. As you know, we already don't have enough social workers. So yes, it is going to present an extra risk, and I want to be clear about that. I don't like having to do it, but it's necessary with this coronavirus, and going forward, we need more social workers with more visits once we're out of this. It's like all these steps that we have to take. I know in every single recommendation or every single order I put down that there are negatives that come out of it. And I want you all to know we don't take them lightly. We are just going to make sure we take those aggressive steps that we have to take to get through this. Let me read one more, and then we'll. Will people who don't have health insurance be allowed to get free testing? Yes, we're going to make it happen. Many of them can already get it, but we are absolutely going to make that happen. The same reporter asked for a demographic breakdown. We gave it.
On the Grand Princess, one last thing. Are you having to guarantee to the federal government that you will keep these people in isolation?
I don't know if we've guaranteed it, but we did tell them that we'd do it. I told the federal government directly that I would take full responsibility for them and that I wanted them back.
We're asking employees to work from home. Is that something you're trying to do at the Capitol as well?
Yes. Our goal is to reduce our in-person staffing by at least 50%. We are encouraging as many folks to telework as possible. And then we're allowing people to self-ID if they believe, without telling us which one, that they fall within any of the vulnerable populations under the CDC guidance. And then we will ensure those people have the telework capabilities. We want to make sure that we are modeling as best we can the behavior that we want to see. Morgan.
Two questions for you, if that's okay. One is...
Two?
I know. So one is the state, are there any requirements or guidance when doctors call saying we want to get X patient tested? Are you guys still asking, to determine if they get a test, have you traveled to a high volume area where there's a lot of cases, or if they already have a respiratory virus or infection of other kinds, are they being denied tests? How is that working? I'm
going to let Dr. Stack step up. I will say all of these calls are collaborative, and as we move forward, where people have traveled is no longer going to matter. This is communally spread. We wouldn't be making the major changes to reduce people's context if it wasn't.
So thank you. So the question is, are we asking people about travel history and other criteria when they call for testing? So again, I want to say exactly what the governor said. We want everybody who needs a test to be able to get a test. And we can't wait for that to happen soon enough. On the other hand, it's not really about calling the state now to get a test. It's about getting capacity so when you go to a hospital, a doctor, a clinic, or wherever else, should we establish other locations specifically for this purpose across communities, that you go there and you get a test. So the question that was relevant a few days or a week ago about how the state determines who to test becomes less relevant now as we shift to more normal healthcare delivery and rely on the commercial sector to provide that service. So we will now fall more into a support role, but we will continue to press for the commercial sector to get up their capacity rapidly so we can test everyone who needs it.
Are you seeing community, you mentioned earlier this week, that you'd seen there was evidence of community spread in Harrison County. Is there evidence of that in any of the other counties where you're seeing it?
The question is, do we see evidence of community spread in other counties? The answer is yes, because we have individuals that test positive. That you can't claim it's any specific travel. And even as we look at the very first patient in Harrison County, they're not the very first person who has had the coronavirus. So let me close by saying, let's remember we have two duties. Number one, make sure you're protecting yourself and others, yourself and your family from getting the coronavirus. Number two, do everything you can to keep from spreading that virus. And understand as we move forward, there's probably going to be a time where people that have this virus. We're going to make it through it. For 80% of them, they're going to be fine. But we really need to make sure, Kentucky, that we remain calm. We're going to get through it. We are a resilient people. We have been through a lot at different times, and we always make it out the other side. Now, this is different than things we've dealt with in the past. But with our challenge, knowing that the vast majority of people are going to be okay, and we're taking the significant steps to protect the most vulnerable, ought to hopefully quell some of that anxiety, but give us a sense of duty, of helping our fellow man and woman, and truly coming together as a state and as a country for what we need to do. So we're asking all of you, be a good teammate. And let me finally just say, Dr. Brenzel talked about kids, and if you're talking with your kids and you see some of their anxiety, I'm there too. Trying to explain to my kids what's going on with a 9-year-old and a 10-year-old, it's a challenge, but I know they're going to make it through too. And spending that quality time, if you have that opportunity to do with your kids, do it. There's nothing better. There's nothing that makes you feel better. And if what this does is give you a little bit of extra time with your kids, try to treasure it. It'll make it easier for all of us to make it through. So we'll provide another update at 4 p.m. tomorrow. And I appreciate everybody out there, everybody taking ownership, being a good teammate. We are going to make it. We're just going to have to make some changes, but we're going to make it. Thank y'all.
Thank you.
All right. Did you get to shoot horse with your son?
Broke finger.
Oh, that's right.
Why is it the wrong
Still can't-
time?
Still can't do it.